All right, good afternoon, everyone. This is Dorina Simiano from AgeWell's Network Management Office. We're going to get started this afternoon with our part 3 of our Creating the Future webinar series for the year. To make sure you're in the right place, we are talking about building an innovation hub case study today. I'm going to introduce our speakers in just a moment, but first, I want to tell you a little bit about AgeWell. So AgeWell is a network made up of over 250 now, I believe, researchers across 40 universities and research centers in Canada. We have over 250 partners, so that's government, non-for-profits, and industry partners, over 500 trainees or highly qualified personnel, HQP as we like to call them, and as well as about 4,500 older adults and caregivers that make up our network. So as Canada's technology and aging network, our vision is that Canada's leadership in technology and aging benefits the world. And our mission is to develop a community of researchers, older adults, caregivers, and partner organizations, as well as future leaders. So you see, in many ways, we've built that community. There's over 2,000 members in our network, and really the goal is to accelerate the delivery of technology-based solutions that make a meaningful difference in the lives of Canadians. We are federally funded by the Networks of Centers of Excellence program through the Government of Canada. So as we go through this webinar, I want to encourage all of you to type in the chat box if you have any questions as we go through the webinar. There's also a Q&A function, which you will see at the bottom of your screen. And before I introduce everyone, I'm going to launch a poll, and I just want you to tell me how many people are joining you if you're on your own watching this webinar, or perhaps you're in a group of people. Just let us know, and that helps us keep track of our attendance. So as you do that, I will start the introduction. So first up, we will have Dr. Josephine McMurray. She's an associate professor and director of case at VTM at Wilfrid Laurier University. We also have Dr. Frank Knoefel, who is a physician at the Bruyère Memory Program. We have Rafik Goubran. He's Vice President of Research and International at Carleton University. And we also have Dr. Bruce Wallace, who is the Executive Director of our National Innovation Hub in Ottawa, SAM3. So welcome to all of you. And I'm going to pass it now to Josephine. Take it away, Josephine. And make sure you unmute yourself. We can't hear you yet.
Hi there, sorry about that.
Oh, no worries. Yeah, I can hear you now, so please go ahead.
That's okay. Yeah, no, for some reason I was unable to unmute myself. So I apologize, everybody, for that rather awkward delay. Before we sort of get into the granular details of the SAM3 Hub and how it was conceived and started, Frank and Bruce and Rafik thought it would be useful for me to talk a little bit about innovation hubs and some of the terminology. But the journey to and the theory behind the innovation hubs is a little bit circuitous. And the population of the the term has been something which has meant that practitioners and scholars are using it synonymously for things that are sometimes quite different. So I'm going to run through some of the differences between innovation ecosystems, clusters, accelerators, et cetera, so that we remove a little bit of the ambiguity and you have some context in which they're going to talk about innovation hubs, which ultimately, you know, all of these things should in fact be improving the lives of people generally and patients and caregivers specifically in our context. So let's start with the regional innovation ecosystems. So innovation systems or ecosystems are both geographic, they can, and physical, but they can also be virtual. And it refers to organizations from research, government, industry, and community who collaborate and get linked through shared infrastructure. Also, it involves inclusion of the built environment and then also relationships. So these innovation systems can be national, which is a really tidy way of explaining a country's policy and sort of resource allocation towards innovation. But generally, researchers have said, you know, you need to be able to get down to the granular level and talk about regional innovation ecosystems where the mechanisms or the levers that support success in those collaborations really are best understood. So that's what we focused on when we developed this little model around regional health innovation ecosystems. And this should explain in its entirety how the relationships, the physical infrastructure actually meets together. So you have research, you have government, you have industry, you have the local community, and then you have this sort of special piece, the health piece. But the way we have developed this model, the key to innovation and growth is really the knowledge that flows between and within the people in these organizations. And so we've put people and innovators at the very center of this model because they too actually flow around these organizations oftentimes. So they'll come out of research, they'll go into industry, sometimes they'll come out of industry and go to research. So while policy, regulations, resources, you know, all of these things that we've got in the middle there are grease or sometimes friction within these systems, the development of people and capabilities is really the key to regions developing this world-class innovation. So one thing that I do want to sort of put out here is that the regional health innovation ecosystems are really uniquely centered around health. And the health system tends to shape the kind of health and age tech innovation that comes out of there. And there are lots of barriers as well as facilitators to that kind of innovation in the health innovation ecosystems. And some of those are these, you know, professional tribes that we have, sectoral silos between, you know, different parts of the health system. It's highly regulated. We tend to be very risk averse within the healthcare system. Tons of funding challenges and very long investment cycles, particularly if you're thinking about sort of the sort of drug-related part of the healthcare system. And at the moment, we also have this other overlay, which is this rapidly aging population, a bit of grease for the system, and also this growing pressure for openness and user centricity, which again is very much grease for the system. So, so that is the regional innovation systems at the very sort of, you know, the underneath national innovation systems, which are more policy driven, are these regional innovation systems. Innovation systems can also be sectoral or technological, and so oftentimes all that is just it means that they cut across regions. And usually those innovation ecosystems have physical components to them, but they're very much focused around a particular strategy or a particular sector. So for instance, in 2017, the federal and provincial governments developed something they called the Pan-Canadian AI strategy. And that helped to create something called the Vector Institute. And I'm not sure if any of you have actually heard of it, but that is an institute down in Toronto that is focused primarily on becoming a leader, a global leader in AI. And they hired the world's foremost expert in deep learning, a guy called Jeffrey Hinton, who in turn has attracted incredible talent internationally. And so now these folks are actually pumping out sort of over $800 million worth of sort of new AI and tech-related investments and expansions in Ontario as a result of this kind of sectoral innovation ecosystem that they are creating. So that's sort of a subset of these regional innovation ecosystems. Okay, on to the next slide. And on to the next, concept. And actually, I realize I've just popped through. Sorry, my access to this is actually a little bit, Dorina, is a little bit wobbly. Can you hear me again? Hello?
Yes, I can hear you. There was a bit of an echo there, but you're okay now.
Can you do me a favor? Would you mind actually taking control? So there is a lag in my system, and so take me back to the clusters slide, and I'll let you know when I need to go from one to the next.
Sure thing, yep.
It's just not working particularly well with me having control. Awesome. Okay, so underneath this concept, so we've got this hierarchy and these nesting of concepts, and underneath this, their regional innovation system, we have this sort of next innovation entity, which as we head to innovation hubs, and that is the cluster, this cluster concept, and this is where usually because of wanting to encourage economic development, they build these dense geographic sort of areas of business activity, which have sort of critical mass, large and small companies, post-secondary and research institutions, and other innovation actors, particularly in industry. And being geographically proximate means that they really benefit from more efficient and responsive supply chains. It encourages knowledge sharing and collaboration between these groups. It drives collaboration and business specialization, and it usually helps to sort of attract anchor companies from around the world. You'll oftentimes see these clusters sort of, there is usually a science park involved with this. There's usually, as I said, a big anchor company like an IBM or some large multinational, and always there are universities associated with these. And these clusters have real potential to spur innovation, but most importantly to these entities, they support commercialization and productivity of these new innovations. And it helps these regions and these clusters become internationally competitive. Sometimes you'll hear people refer to super clusters, and we've just had a CFI call, which has been around the development of super clusters, one of which I was on, which was unsuccessful, unfortunately. But these usually relate to the numbers of participants and size of these clusters. And it usually means that the cluster is actually it's more geographically dispersed, but with really tight connections between them, usually and sometimes contractually driven between the players, because to sort of make up for the fact that regional players usually can develop trust and tight collaboration, whereas geographically it's a little harder to do. So you see, as clusters and partners move further away, they replace that trust of proximity with partnerships and contracts. So at the moment, BC has something called a digital technology supercluster. It's one of the 5 that was just handed out by the federal government, gave out $950 million over 5 years. And that's attracted TELUS, Microsoft, Shoppers Drug Mart, D-Wave, Appnovation, a ton of universities, and also University Health Network in Toronto. So that supercluster is expected to drive economic development around that particular topic. And so that's, very much indicative of that one of the things that helps to drive success in any of these entities, which is where the players who are involved with the entity actually define some sort of special area that they are going to excel in. And you'll see some regions that come out and they'll just sort of be generally supportive of innovation. The ones who are really serious usually bear down, and they find some either historic context for a specialization, or they're doing some future gazing and they say, this is where we think the next big trend is going to be, and vis-a-vis Toronto with AI. You'll sometimes hear talk of things are called innovation districts, and that's more just an urban sort of a construct similar to a cluster, but it's usually about pulling a group of some sort of urban development strategy, usually generated around an underperforming developing neighborhood in that city. But that's called an innovation district, and it usually involves the city sort of becoming involved with investment in that area. So away from clusters and innovation districts, onto the next slide. And we're going through this sort of, again, this hierarchical and now this nested concept where we head into accelerators. And accelerators are locations located within these regional ecosystems. They're generally associated with high-tech startup firms who are already generating revenue from their solution or their product. And what they need is very specific resources to help develop their solution and to be able to market it. So one of the most well-known examples of this is Y Combinator in the Silicon Valley. And I've got a picture here of the one that's here in Waterloo, very successful. Usually what happens is you take these companies and you give them very specific access to mentors and investors. And it also pulls a bunch of founders together so that they're going in a cohort and they can be mutually supportive. And some interviews that I've done with local founders in these accelerators and incubators talks about this importance of cohorts of people going through, where they're going through the same thing at the same stage together. Sometimes these accelerators will focus on a particular sector as well, so that the cohorts that are going through are very specifically focused, for instance, on health or biomed, because those are complex. Not all investors understand them, and so not all investors want to get into them. So this mentorship and access to very specific capital, and sometimes large amounts of capital, is important. So they are revenue generating at that point. They've already gone to market, but now we're looking at scaling them up. So on to the next slide and the next construct. And so this journey now takes us to the incubator. So we're sort of getting more and more granular. And similar to a neonatal incubator that all of us will have seen if we've had a newborn that has had some trouble at birth, business incubators are places where startup companies are nurtured under conditions that are intended to help them survive and grow. So these enterprises are startups and they're pre-revenue. It means they're not getting any money that people are pulling out of their pockets to pay for their solution. But they've developed an idea and usually a minimum viable product. So they need space, they need coaching, they need access to how do you market, they need access to strategic partners, angel investors, and information about technology commercialization and IP assistance. So that's usually what happens in these incubators. The time in these incubators is limited, just like accelerators, and it's usually less kind of draconian than accelerators, because with accelerators, you go through a cohort, very specific goals that you have to meet. And if you don't meet them or sort of move along the development cycle, you're out. With these incubators, they tend to be a little more forgiving in that with the development of these ideas, they oftentimes have to pivot a couple of times before they hit that sweet spot where there's a potential for them to actually go to market. So on to the next slide, and I think I'm going to be on time, but just innovation hubs. This is what we're talking about today, and this is the smallest unit that's nested under our regional innovation ecosystems. And these innovation spaces or research centers are collections of individuals, organizations sometimes, who interact and collaborate to develop novel solutions that solve social or commercial challenges, whatever they are. They most often involve sort of early research and the development of early stage products. Often there is not a formal startup involved with this. So sort of, it can be just one person working, and there are a couple of people. So there may not be sort of an enterprise associated with these entities who are working in incubators. In fact, they might even be coming into the incubator to look for partners or people that they need to work on parts of their solution. It can also be a place where translational research is coming in, so people who have got some really interesting sort of biotech information from pure research, and they want to actually develop tools and products that are going to help solve some of these medical gaps or needs. So again, right down to sort of the innovation hubs where it's the most granular. And these are quite different. You're going to hear from SAM3 today, which is different from an innovation hub that might be happening in Waterloo. If you're considering setting up an innovation hub, though, there are sort of 4 critical features as you're thinking about the sort of, not only finding a physical location, but also, where are we actually going to set this up? You need to have a vibrant regional innovation ecosystem in which to build a successful innovation hub. And so that means generally you need a very wide network of linkages to help with this flow of people, of knowledge, of technology. So having lots of entities that are involved with innovation work and with commercialization and with the healthcare sector in our particular case is really important. The actors who are going to be involved with your hub have to devote substantial resources to those kind of activities. They have to be all in with R&D. They have to be all in with supporting the activities within these hubs. And so it's not a place where you want to have people who are concerned about the risk, or are people who are, who are limited in their enthusiasm for this type of entity. They tend to provide some services, but they're not as comprehensive as the things that you'll find in, for instance, in the incubator or in the accelerator. So some minimal services, and usually some sort of framework to help them move through the process of innovating in this space. And this innovation space has to be super innovation friendly. So it means you have to have really good industry-university relationships. You have to have places that help with commercialization. Next slide. I did want to point out though, I forgot to advance my slide. If we can go on to the next one, we just covered that. I did want to talk just a moment about the frictions that happen when you bring together startup ecosystems and health ecosystems. And it's a bit of an elephant in the room. We know about all of these things, but I think it's important that if you are a researcher who hasn't been in health, or you're a health researcher or innovator and you haven't been into a startup ecosystem before, you sort of got to understand, both of them are arts. That's great. One's driven by social science, the other by pure science for the most part. Both of them have these hierarchies, so that works well. But the health system and ecosystem is driven heavily by skepticism and restraint, whereas startup ecosystems rely on the people who are in it to be optimistic, to amplify the capacity of their solutions, to be able to express what potentialities there are. And that's not something that we do easily within the healthcare system. We demand accountability in the health ecosystem, whereas in the startup ecosystem, oftentimes there's sort of an input and an output in between. There's a bit of a black box. So oftentimes that will make folks nervous. The other is just benevolence versus self-promoting. Oftentimes people who are in this health ecosystem are in there because they want to be providers. There's a more altruistic approach. In the startup ecosystem, it's very self-promoting, and you have to be that way if you're going to go in and satisfy the needs of investors and show them that you mean business, versus in healthcare where we rely on the professions for this, very professional and oftentimes more restrained approach. So I'm not going to get into solutions today, but I just wanted to point out that, if you're getting into this space, that's something that you're going to have to negotiate. The final couple of things I just wanted to talk about was this idea of, and the next slide, Successful innovation hubs, again, if you can build your innovation hub within an existing innovation system where there is capacity and history, that's much easier than if you're trying to do this from greenfields. You need to have a very strong local network of mostly human capital. That's, you know, incredibly important. So that's why you'll see oftentimes these innovation hubs are built around places where there are sometimes two or more universities within a short diameter of the innovation hub. You've got to think right up front about being globally competitive. So coming in and thinking about, you know, how are we going to not only make a difference here in our region, but how are we going to be a global player? Because quite frankly, now, you know, your competition is not just the innovation hub in the next county, or next province. It's the innovation hub in, you know, Estoril in Portugal, or in Chongqing in China. So thinking about that, the other is just having this access to continuous flow of what I call attractive players. And those are the people within your regional ecosystem who, you know, sometimes it's key entrepreneurs who have been out there, they've had, you know, major success, and now they want to come in and give back. It may be the fact that you have had some sort of MOU with a large company like IBM, and suddenly you know somebody within IBM who's a clear champion for you if you're looking for a large anchor company. So these really are, you know, building and sustaining sort of collaboration around the world is where you need to go. You may not have it originally, but certainly that's something that you need to think about. And then you also need to think about some of these key building blocks. Again, that refers to these local networks and the social capital that comes within, you know, that local region. But it also means as well having some capacity to manage your hub in a very systematic way, making sure that, for instance, that grants are being applied for, that you're reporting and developing performance metrics so you can report to key stakeholders, because you've got to be able to sustain that. Next slide. And this is now my segue into the next speaker. And just to say that the Ottawa innovation ecosystem is rich and diverse. And so when Heidi and I were sitting down and talking about this very early on, and we had chats with Frank and Rafik, we just went in and we mapped out all of the potential partners and the amazing resources that were within this ecosystem for the SAM3 hub. And you suddenly started to see, this is actually pulled out, but there is just this enormous number of very rich resources in a very rich environment. And that was, you know, it became a perfect location to be able to start this kind of innovation hub. So with that, I have gone a little over my 10 minutes, sorry, and I'm going to hand off to the next person.
Great. Thank you, Josephine, for that. So I'm Frank Knoefel, and I'm going to be talking about the next, how we sort of, the history of the hub before it actually happened. And okay, here we go. So I'm obviously a physician here at the Bruyère Memory Program in Ottawa, but before I went into medical school, I actually was at a crossroads. I wasn't sure if I was actually going to do engineering or medicine. I then did my training in medicine and care of the elderly, and it was actually when I was facing patients in geriatric rehabilitation that I sort of really got interested in the engineering side of things again. So my example patient is an 82-year-old lady who's living by herself in an apartment. She's got mild memory problems, mild health problems. She falls and breaks her hip, goes to acute care, gets that fixed, and then, of course, the next day she doesn't just get up and walks, and so she comes to us for geriatric rehab. And then after a couple of weeks, we tune her up. She's walking better. Her medical health is relatively under control, but she's got a little bit worse memory problem, and so I'm really concerned about discharging her home. Her family might not be living in Ottawa, and then, you know, the question was, how could we safely discharge her And that's sort of when I went and said, I wonder if technology can help us. And I soon partnered with Rafik Goubran, who's going to speak shortly, who's an engineer with multiple patents in all kinds of things, but in particular in microphone arrays. And when Josephine was speaking earlier, it really describes him perfectly. Here's someone with years and years of experience and who wanted to do something that wasn't necessarily for the private sector, but that would provide some social good. And coincidentally, not coincidentally, his wife is a physician, so he's been close to healthcare, and he thought that would be a great space to continue in. He was the Dean of Engineering and is now VP Research International at Carleton, and of course, having high caliber people like that is really important. Heidi Sveistrup, who unfortunately couldn't be part of the talk today, has been a researcher in rehab science for many years. She had a joint appointment at the Faculty of Health Science and the Bruyère Research Institute, and is now the CEO and Chief Scientific Officer at BRI and Vice President of Research and Academic Affairs at the hospital here at Bruyère. And I'll get to the timeline shortly, but she's been with us from early on because of her clinical expertise. And Bruce Wallace, who will speak a little later as well, did his engineering master's at Carleton University a number of years ago, and did it with Professor Goubran. So you can see how this network sort of interlaces and interconnects early on. He then went and worked as a senior executive at Nortel and was lead of a healthcare vertical there. So found his way to the healthcare field again at Nortel, and then decided to do a PhD in engineering and was co-supervised by Dr. Goubran and myself. And he stayed on and is now the SAM3 Executive Director. So very quickly, just to give you an idea of the timeline, it really began in 2004 when we got a very tiny $40,000 grant from the Change Foundation, which allowed us money to renovate an apartment here at the hospital that would allow us to create sort of the first smart apartment. We had, Dr. Goubran already had a number of master's and PhD students on the go, and we joined together and directed them into sort of this area of research. And 2 years later, we had our first joint publication. Heidi joined the group soon after, and especially with her expertise in mobility. This was important when we were doing bed transfer research. And 2011, a year later, Bruce joined doing his PhD. We connected with Alex Michailidis in 2013 in preparing for AgeWell. And by 2015, AgeWell had started, and Dr. Goubran and I myself were the co-leads of Work Package 5.0, and Work Package 7.2 has Josephine and Heidi in the Drive project. So you see how this really is sort of, it organically came together. And Dr. Goubran is going to take over from here.
Okay, so the first time we started thinking about the hub was at the AgeWell AGM in Calgary in 2015, and that's where we had our first discussion about the possibility of establishing a hub. And then we had a few meetings in Ottawa in early 2016, and by April we had our draft AgeWell application to establish the hub. And then in November 2017, it's when we signed everything and we actually launched the hub at the Bruyère Research Institute. Next. So what is the hub? So the hub is called SAM3. So it stands for Sensors and Analytics to Monitor Mobility and Memory. So the idea here is to have sensors that are embedded into an environment, and then the data from these sensors is collected and analyzed in order to extract useful clinical information about the occupant of that environment, And that information helps us monitor two things, one being mobility and the other one being memory and cognition. Next. So the core partners, so we have Carleton University, and from Carleton, it's mainly the engineering group, but there are participants who are involved as well, whether it's computer science, whether it's health science, whether it's business, technology, innovation management, or industrial design. So we have a few colleagues involved as well from outside engineering. Then the Bruyère Research Institute is a major player as well, is the major player from the health perspective, where we have access, of course, to the Elizabeth Bruyère Hospital. And with the interaction that BRI has with Algonquin College, the University of Ottawa, it helped form a very strong academic core for the hub. So we have a lot of researchers coming from the University of Ottawa who are playing a major role in the hub. In fact, Dr. Knoefel and Dr. Westrup, both of them are professors at the University of Ottawa as well, and we have colleagues from various disciplines, including engineering and health science. Community, we have Bruyère Continuing Care, including the various hospitals there, being the Elizabeth Bruyère Hospital, the St. Vincent Hospital, Perley Rideau, Care For, and we have family members as well engaged and caregivers involved in our discussions and several other organizations to have the community aspect. From a business perspective, I would divide the businesses into three main ones. IBM is more into the Watson aspect, which is more on the analytics side of things, where the Watson analytics would help find correlations, find interactions, find relevant information from various sensors. And then in order to get the information from the apartment and put the information into the cloud for cloud processing by IBM, we need the connectivity. And TELUS Health, TELUS in general and TELUS Health in particular, turned out to be the ideal partners because they provide the telecommunications infrastructure to connect all of those parts together, to get the information or the data from the sensors into the cloud, to provide the information from the cloud to, let's say, smartphones and smart devices to be able to inform the process, to perform some real-time feedback to the users and so on. All of that requires a very sophisticated telecommunications infrastructure, and certainly TELUS is very interested in the health aspect as well. So in addition to the analytics and to the connectivity and telecommunications, we have major players who are involved more on the sensor side of things, like safety labs, where they're looking more at vital sign collection and then sending the information to the cloud and getting the information back to the clients. Hexu in Oshawa, who's looking at material where we could embed pressure sensors to monitor people in bed. We have Able Innovation to look at mobility. We have Ariel in Montreal, who is working on sensor systems to detect the activities of daily living using Wi-Fi sensors throughout the environment. Now, government, of course, we have very good partnership with the National Research Council, with the Champlain Lynn, and various other government organizations to complement the core partners there, being academic, community, business, and government. Okay, next, please. So the overall structure, we have the executive team running the hub, but also we have community advisor committee, affiliated researchers and trainees, researchers from the core institutions, but also, as I mentioned, from many other institutions, including graduate students, masters and PhD, postdocs, and full-time researchers. Industry partners, so we have the industry partners group, and that involves the partners I talked about, being the analytics, the telecommunications, and the various sensors. And we have links to other AgeWell national innovation hubs, being the policy in New Brunswick and the digital health in BC. Okay, yes, Bruce, it's your turn now.
Okay, so let's just keep rolling. So first of all, sort of building off some of the things Josephine was talking about, and Frank and Rafik gave the overview. Some of the core capabilities we brought to the table with SAM3 is just, bricks and mortar research facilities. So Frank mentioned the building out of the apartment historically. We have done some renovations on it and moved it forward, and we're now using it as, it's on the 4th floor of the hospital, and it's our smart apartment, very conveniently located right in the middle of 2 care wards. One is a geriatric day hospital taking care of frail older adults who are living independently in the community. So a key target clientele of the kinds of technology we're working with. And the other side is stroke inpatient. So patients who have recently had a stroke and are in their early stage OT, PT rehab cycle with the goal of getting them back home. So it's a nice facility. It's a real world facility in the sense of it looks like an apartment when you walk into it, and it could function as one if you wanted to live there. At Carleton, when the building becomes available, we're going to be moving into some space in the ARISE building, so the Advanced Research and Innovation in Smart Environments. At the moment, we are working out of labs and facilities in the Minto Case building, so the core engineering school. Next slide, Frank. Thank you. One of the key things we mentioned, we need to build out the community capability that we can reach out and tap into. So from the Bruyère standpoint, we have the extensive team of clinical researchers and graduate students that are coming at healthcare challenges from a health sciences, medicine, etc. perspective and skill set. We also have the patient populations that we can reach out to, because one of the nice things Bruyère does is patients, when they're coming through the hospital, are asked if they're interested in research. So we can, with ethics approval, we can reach out and contact them about their interest in trials. Bruyère is a nice mix of populations because there's an inpatient space, a large pool. I mentioned the GDH of outpatient services the hospital provides, and in addition, it operates out in the East End, a combination of facilities all on one site that encompass everything from Bruyère as the operator of a licensed long-term care facility through to basically Bruyère is the landlord and you are renting an apartment from them, and a number of assisted living levels in between. Rafik mentioned, and Frank, the Carleton University. Again, we have the faculty, the grad students, and et cetera, and predominantly engineering, but interactive multimedia, industrial design, reaching out into the business schools, health sciences, et cetera. The community that we've been able to tap into is exceedingly powerful and useful. Care providers in the community, when you're trying to reach out to people in their home in trials, the community care providers, whether it's home care, PSWs, nursing, Care4 being a lead example of that, or the people that are providing services in the community. We've done a lot of work in partnering with DSORC, the Dementia Society of Ottawa and Renfrew County, which is again providing services in a different way, but out into the community and working with people. And then lastly, the Community Advisory Committee. So it's a group that we have formed. It's got a combination of people on it that are themselves aging adults, caregivers of aging adults, either historically or currently, and people who are actually in the providing space. A couple of people from some of the long-term care operators that have different views and expertise, and it's really powerful to bring them together and to hear their ideas and suggestions. So let's keep going. Next slide, please. Some example project areas at the high level, and then we'll jump into some slides which can get into some more specific ones. Rafik alluded to it so in his presentation. So some of the solution providers we're working at, he mentioned some of the companies, are looking at sort of system level solutions for the home. How, figuring out how we can build them out and solve very particular specific problems and have a solution that works, that solves a focused problem. The next piece, which is where part of the work we do with IBM and part of the work we're doing at TELUS fits in, is how do you support that smart home from the cloud? How do you get the sensor, IoT data, whatever you want to call it, out of the house and processed in the cloud in an efficient way? And then the last space we're working on, we don't do a lot of work in creation of new sensors, but there's a couple of areas we have specific, significant expertise in the team and are continuing to move forward, and that's specifically in the pressure-sensitive mats. So we'll just talk quickly about a couple of example solutions. So this one, supporting caregivers, this is a repurposed solution. I'm not going to go into the details in the interest of time. This is a solution specifically focused on supporting caregivers that are themselves taking care of persons with dementia, and the specific issue is, the risk of elopement by the person with dementia. But the more particular question is using smart home and smart technologies to allow the caregiver to sleep at night versus sleeping one eye open, worried about their loved one walking out of the house. This is an interesting project in itself, just from the partnerships that involve, because we do it in conjunction with the Champlain Lynn and working very closely with a couple of long-term care providers and the Dementia Society. Let's move on to the next one. Supporting from the cloud, this is sort of a thumbnail of the challenge we put in front of ourselves, and the good news is I can now put the tick box on the bottom. Right? The cloud doesn't want a lot of neat things, but the questions we put in front of ourselves is, how do we implement real-time flow of the IoT data stream from the house out, training the system in the cloud, how do we get it sensor data, etc. And this is a project we've done in collaboration with IBM, and we are now able to real-time stream data into the cloud and process the data against trained AI models in real time. So let's go to the next one. Pressure sensitive mat. This is, the kinds of things we've historically done with pressure sensitive mats covered on one slide. The key thing here, and this is Rafik mentioned HEXU, is taking our expertise in sensor and pressure technology measurement, result of a couple of graduate student projects over the recent years to create some new sensing technologies in partnership with the company HEXU, which has some very interesting materials, which hopefully the two things are going to come together, and that's an ongoing project, into what should be a new product quality mat that'll be better than anything on the market. So we're hoping to get there. Next one. I'll just get through the builds. There we go. Rafik mentioned Ariel, very interesting company out of Montreal that is using Wi-Fi to assess motion and capability. So the nice thing about that is it gets away from the issue of video and video analytics, which have huge issues of privacy, and moves to a sensor technology that doesn't use visible light and video. And this is an interesting project where we've been doing it in collaboration with Ariel and have managed to move the yardsticks forward. We have a graduate student who's done some amazing work on using AI and machine learning to do activity of daily living classification out of the motion that's seen in the Wi-Fi. So let's go to the last one. Okay, whoops, there we go. So there's sort of the thumbnail. I think that's been covered previously. In the interest of time, I won't move on. The next slide, and I'll just turn it over to Dorina, is some of the ways you can contact us.
Thank you, Bruce, and thanks everyone. So I see we've got one question that came in, so I encourage you to ask more questions. As we go forward, before we get into the question piece, I just want to point out to you that we have a survey that we like to have participants fill out about the webinar. So I'm just going to send it in the chat box right now. And we also have a webinar that is coming up in September. If you can plan that far ahead, it's on September 17th. And we will have our scientific director, Dr. Andrew Sixsmith, talking about how researchers and industry can successfully partner to create real-world products. It's a bit of a continuation of some of the things we talked about today, and the link to register to that is also in the chat box. I will go right into questions now. So we have one from Mark asking, it took over 10 years to get from grant, so 2004 to launch in 2017. Where do you see these hubs in the next 5 years, bringing real-world applications to older adults? And maybe you can talk about your hub. I can certainly try and answer from the age-well perspective. I know if Frank or Bruce, do you want to take that one?
Well, so exactly. So the whole point of the hub really was to go from research that we were passionate about and bring it up a notch, and to really bring it to real world applications, which is why we increasingly have linked to real companies that are more likely to bring it to people than we are, right? So the whole linking in the industry is part of that, but also you have to think about government as well, because part of the challenge is going to be, if this is a service you provide for older adults at home, who's going to pay? Because if it's self-pay, there's going to be some self-selection that happens, and some of the older adults living by themselves in a subsidized apartment are less likely to get this kind of technology than people that are better off. So that's why we've sort of tried to tackle it in all dimensions with our other Innovation Hub partners that are doing more deep dives in policy and that. And I'll pass it on to Bruce.
I think, and then in terms of the projects and the activities that we're going, that I see the hub continuing to do, I think the activities within the hub are going to fall under a couple of different, it's going to be a spectrum of capabilities, and I hate using the word because it's hard to, it sounds euphemistic, but the concept is, we're going to be working with partner companies on projects that are fairly focused on downstream development of technology, right? Technology that's ready, and the goal is, how do we get it from where it is to actually something in the marketplace. There's going to be companies that are going to hopefully be working with us more and more around the creation of the new technologies, and the key there will be the pipeline into the the universities and the researchers that are doing that fundamental research. My other hope and something we're trying to figure out is how do we get the network of companies in and of itself to start and become more powerful and driving forward. Right now you get a challenge of a company wants to move their yardsticks forward, and that they have their business goals, whereas the company next door has their own business goals, which may or may not be competitive or collaborative with the next one. So I think one of the key things we're going to need to move is how do we keep growing on it. And I see, and I hate the analogy, is the shopping mall analogy, which is, people like IBM and TELUS provide some big anchor tenancy, and that's the place that the smaller and the innovative companies want to partner with, not necessarily with each other, but they want to partner with the big companies that can get them to market faster. And I think that's the key big step, is to get sort of that path moving first, and then we'll find the little companies that want to work with little companies.
If I can just
add anything?
Sorry, if I could just jump in very briefly, this is a place where oftentimes too, if you have a look at different ecosystems around the world, there's one that takes into account a region in Denmark and a region in Sweden. It's called, they actually have a very specific entity called the Medicon Alliance, which does nothing but work on actual opportunities between companies. So it actively looks for those kind of synergies, and they have an informal network, getting together. It's like so many things, just informally getting together, working over time to be able to develop personal relationships. But also this very purposeful thing of sometimes it takes, an allied entity which is working to actively look for government or policy opportunities that could support what's being done in the hubs. So that's another piece that can happen, as well as, sort of some of the serendipitous stuff that happens, between smaller companies, or where smaller companies are looking at partnering with larger companies.
Great. So I'm going to keep going with the questions because we've got quite a few coming in. Just for everyone who's on the line, there will be a recording of the presentation provided to you via email, and the slides as well for your reference. So I'm going to go to a question from John from Halifax. Hey, John, he says, we have done a great deal on smart homes and sensors, as well as accessibility in Halifax. We have several projects underway. How can we exchange information with the Ottawa hub? And just to add on to that, we've also got a question about how to make an apartment tour possible. Someone from Pam from Toronto is looking to visit to the hub and hopefully get a tour. So broadly, how do you partner with the hub, and how do you get a tour?
The simple answer is the email address that's live goes straight. It's Bruce, goes straight to one of my inboxes. So, the more specific, send me an email and we'll figure out the schedules and whatever makes sense. As far as technologies, we are continuously interested in understanding where the potential collaborations are with the other technologies out there that people are working on, and where it makes sense. I know there's a number of things we've been looking at. So again, just reach out and let's take it offline and let's figure out what makes sense.
Great. We have a comment saying, I don't see the voice of the user spoken about today. Technology is unlikely to be the answer, far more likely that it will be solutions that engage with healthcare consumer and provide dignity for the users. Surveillance of the elderly is very unlikely to provide dignity. So I think that's a question that we come up across a lot. Any kind of response about how the hub's been engaging end users so far? So
we absolutely have at the table, and any and all of the projects have been discussed with. We have a community advisory committee of older adults and caregivers and care providers that we engage with regularly, and then we reach out further and further in terms of the community, like the Dementia Society and people like Care4, to name two. So absolutely, I guess their voice is exceedingly important, because I like hearing their questions about how can you do X and solve it. And the other key point is, in terms of the intrusion, almost everything we are doing is focused on a passive sensing model. So there is no, for example, video in any of the solutions we're using that is going to be an intrusive of privacy.
And I'm just going to add to that, being a practicing physician and literally seeing patients 4 days a week, I'm very, very close to the needs and challenges of aging, with physical challenges and cognitive challenges. And my patients and the families are always asking, how's the research coming? When will these products be available? the wandering detection project that we put into people's homes, that was based on the Dementia Society saying this is a need. We are afraid of people wandering at night. And when we installed it in people's homes, and after the trial, which was 12 weeks, at the end of the trial, when we wanted to take the system away, they said, no, don't take it away, please leave it. So there is lots of feedback, and this is all about the older adults, and not at all about us. So for sure that they're the center of this research and the center of all of our work.
Great. We have a couple of questions from Lily, so I'm going to just combine a couple. So how do you decide which projects to work on, and are you working with other regional innovation hubs, or do you have plans to do so?
Rafik, do you want to answer that one?
Sure. So, yeah, we're trying to see our best, like what are the needs in terms of the needs of the users, and then try to see expertise around the country in those areas, and try to see who works on those specific areas, and try to establish partnerships with those groups in order to not to reinvent the wheel, but try to incorporate the various ideas together.
Great. Yeah, and just from an age-well perspective, we do have as mentioned, the hub out in BC and the hub in New Brunswick. So BC is focused on digital health, and New Brunswick is focused on policy. And the hubs do engage with each other and try to leverage, connections and projects and things like that. It's an interesting one from Perla. Are building and home developers being considered as part of key business partners? How to involve the sector to start thinking in these solutions and universal designs that could use sensors to bring living solutions beyond older adults?
So the short answer is yes. It's an area that we were exploring in a couple of different ways with some local builders, and let's just say a couple of issues popped up with the particular path we were looking at, as in there's an issue with a particular builder. And that's all I'm going to say. But more recently, I have been starting to dig in with effectively nationally, by going at it from the Canadian Home Builders Association, and starting to have conversations with members, so builders themselves. I'm trying to figure out what the right path forward is there, because I'm very interested in collaborating, because very quickly the home building space divides quickly into two groups. The builders that are doing new builds, so they want to pop up a greenfield and start from new foundation and build a complete new building. And then the other path are the renovation, age-in-place specialty people who are trying to take somebody's existing residence and help them. And I think there's opportunities in both that just haven't quite figured out the specific model, because historically that's an entity that is fairly distant from research in terms of their pedigree, and we have to figure out the right path with them. But there is definitely interest, and it's a place I'm exploring.
Great. And I think one last question as we are going over the 2 o'clock mark. Sustainable operating funding can be challenging for hubs. From our experience, this is from Jill, it can be easier to find project-specific funding, but overall operating funding can be hard over the long term. How have you dealt with this?
So, yes. And I think one of the key capabilities there, and so far, has been the funding that AgeWell has been able to provide. But I completely agree with the comment.
Great, and we do have a lovely message as well from Mary, saying that it's been a very informative webinar. She's reading The Patient Will See You Now, and is saying that it complements that very well. It's all about smartwatches and wearables and monitoring day-to-day activities, so that's great. Thank you, Mary. So thank you, everyone, and for all of you who stuck around for the question period. That wraps up our webinar. Thank you to Frank, Josephine, Bruce, and Rafik for a great presentation. And we'll see you all again in September. Please do take the time to fill out the survey on SurveyMonkey and register for that next webinar using the Zoom link. Thank you.
Thanks, everybody. Bye.
Bye.